Hello, I'm Dr. Marisa Weiss. I'm Chief Medical Officer of Breastcancer.org, and I'm also the Director of Breast Health Outreach at Lankino Medical Center. And I'm thrilled to be here today with my colleague, Barbara Jordan, who is an indispensable member of the palliative care and hospice team at Mainline Health. Thank you so much, Barbara, for being here today. This is such a crazy time out there with a COVID-19 pandemic. And for those patients who are going through both a cancer diagnosis and the COVID-19 crisis, they can feel not just physically isolated with a stay-at-home, shelter-at-home policies in most states, but also they can feel very emotionally isolated. In this situation, how can the palliative care team be helpful, like reaching out and giving support at this time when people feel so isolated?
I think that the palliative care team would be a terrific resource, particularly during this COVID-19 pandemic that everybody's experiencing. I think cancer patients struggle with a feeling of isolation anyway. I personally think that their ability to connect with Breastcancer.org, usually it's in the middle of the night, where they can go online and see what other people are saying and see what your experts are writing and sharing with them, I think is a very important link, even more important now than possibly before, or at least equally important. And I think that patients also at this time are feeling even more vulnerable. So it's not just that they're in a stay-at-home policy. They know that their immune systems have been compromised, and that makes life even scarier. And therefore, having a team of either chaplains or nurses or a doctor that you trust, be at the end of a phone to just call and say, okay, I had this little ache today. Does that mean anything? Or I can't sleep. What can you give me? Or I'm having a lot of anxiety that I didn't have before. What can I do about it? So I think that the resources that palliative care could give, particularly in this pandemic, would be very invaluable.
Absolutely. I mean, you form a relationship with these people. Right. And it's not just, they don't just zoom into your life for one little phone call. You know, they connect with you on a regular basis over time to see how you're doing. And, you know, it's a ongoing dialogue. And people feel very much cared for during that time. And it's really, it could be your lifeline, really, truly, at this really challenging time of your life.
And I think trust comes into it. You're absolutely right. You're developing a relationship with the team, and you have developed a trust. And at this time when everything's up in the air, trust and hope are huge factors.
Absolutely. Absolutely. Well, thank you so much for sharing so much of your knowledge, experience, your empathy, you know, with us today. I know it's going to make a big difference to a lot of people. Thank you.